The purpose of this video is to instruct caregivers on how to perform an Arjo Sara Plus transfer. This lift supports patients beneath their elbows. Even patients with very weak arms can still stand. For patients with a stroke, this will approximate the glenohumeral joint, actively engaging the latissimus dorsi. The knees are blocked to prevent buckling, and a strap behind the pelvis helps to lift the patient into a standing position. This is a great way to get patients to stand when they lack the strength to do so. This lift is appropriate if a patient is actively able to contract their quads and glutes and contribute 25% of the force needed against gravity for weight-bearing capabilities, but still struggles to fully stand, even with the assist of two helpers. This is also good for patients who have some upper extremity strength but can't use the arm well enough to push or pull themselves to stand. The patient must be able to follow directions and cues well enough to participate in the transfer. The patient also must have enough neck control to independently hold their head up. This is appropriate for patients who are unable to stand but would benefit from doing so for weight bearing, posture, leg strengthening, and cardiopulmonary benefits. It is a good transition for nursing staff to maintain safety while reducing dependency on the Hoyer lift. The weight capacity for the Arjo Sara Plus is 420 pounds. Precautions and contraindications. If the patient has individualized or modified sternal precautions, the Arjo Sara Plus is not recommended. The easy stand would be more appropriate. For patients with amputations, this device is allowed only if the patient can safely stand, bear weight through one leg, and has adequate upper extremity strength and trunk control. With a kiwi on, a patient may need to abduct the leg to the side prior to standing. If you have concerns about maintaining residual limb integrity or if the patient is unable to maintain standing on one leg in the lift, consider using a slide board for transfers instead. Ortho patients must have at least 50% weight bearing allowed on the affected limb if the foot is to be on the plate. Bulky cam boots or casts may not work well with this device if the patient is non-weight bearing through that limb. If the patient has excessive abductor tone, it can cause the shin to shift laterally off of the shin guards. The patient may require a strap or gait belt around the lower legs to prevent this, or a person to hold the lower leg in a neutral position while the patient is lifted to standing. If the patient has any incisions or open wounds, make sure that the device does not shear or rub on them. Bed to chair transfers. Explain the procedure to the patient and make sure that they verbalize agreement. Sit the patient up on the edge of the bed. If the patient has poor trunk control, you may need to have a second person provide trunk support from behind. One helper should cue or assist the patient to lean forward while the other slides the gray sling behind their low back as far down as possible. Fasten the safety belt around the patient's waist. Pull the strap to take up any slack. Next, bring the Arjo Sara Plus close to the patient. Cue or assist the patient to lift their feet onto the platform. Once the patient places their elbows on the forearm support and grasps the handles, thread the rope connectors of the Arjo Sara Plus through the connection points on the sling. Slide the connector through its receiver to lock it into place. Repeat this on the opposite side. Grasp both ropes in your hands and then lift up and pull, taking up all the slack. Bring the ropes down to lock them into place. Adjust the height of the shin guards as necessary, making sure that they are in full contact with the patient's knees. Use your feet to lock the brakes on both sides. Press the up button on the controller to raise the patient to a full standing position. Cue the patient to stand fully, focusing on upright posture and squeezing through the glutes and quads. Unlock the brakes on the front wheels. Roll the Arjo Sara Plus away from the bed. A second person should stand next to the patient for extra support. Turn the lift to line it up with the chair, angling the legs of the device around where the patient will sit, widening those legs with the controller if necessary. When the backs of the patient's knees are in contact with the seat, lock the brakes, push the down button on the controller, and lower the patient. The second person should continue to provide extra support until the patient is comfortably sitting. Lift both ropes to relieve the tension on the sling and then have the patient lean back. Slide the connectors from the receivers and detach them from the sling. Remove the sling from behind the patient's back. Unlock the brakes. Assist the patient with lifting both their arms and legs off of the lift if necessary, and then roll the Arjo Sara Plus away from the patient. Chair to bed transfers. Cue or assist the patient to lean forward. Slide the sling between the patient and the chair, bringing its sides under the patient's arms. Fasten the safety belt, pulling on the strap to tighten it until it feels secure around the patient. Bring the Arjo Sara Plus close to the patient, cueing or assisting them to lift their legs onto the foot plate while bringing their knees into full contact with the shin guard. Thread the rope connector through the attachment point of the sling. Then double it back, fitting it into the receiver to secure the connection. Repeat this on the opposite side. Pull up on both ropes to take up the slack, then pull down to lock the position. Use your foot to unlock the brakes on both sides. Press the up button on the controller to lift the patient to stand. A second helper should be standing by for extra support as necessary. Once the patient is fully standing, use your foot to unlock the brakes. Pull the patient away from the chair, turning them towards the bed. Cue the patient to stand as tall as possible, focusing on upright posture and pushing through their hips and knees. A second person should be standing near the patient to support or facilitate as needed. Use your foot to lock the brakes. Then use the button on the controller to lower the patient until they are sitting at the edge of the bed. A second helper can provide trunk support if needed. Lift both rope connectors to release the tension on the sling and cue or assist the patient to lean back slightly. Disconnect the connectors from the sling, then unfasten the safety belt. Unlock the brakes, then begin to move the device away from the patient, cueing or assisting them to lift their feet from the foot plate. A second helper should be standing by in case of loss of sitting balance. Assist the patient with returning to a supine position. Special considerations. If the patient has tubes or lines, take care not to tangle or compress them during the transfer. If the patient has mindful moving precautions, they may use the lift. However, cue them to bring their arms forward to place them on the forearm supports, rather than abducting them. Both the shin guards and the foot plate can be removed, if desired, so that the patient can work on early stepping. Unlike the Hoyer lift, the slings for the Arjo Sara Plus are not disposable, so be sure to properly sanitize it after each use. To prevent the ropes from tangling or catching, you can secure the rope connectors with their receivers before storing the device. Check the battery prior to use. If the battery is running low, spare batteries are kept on chargers in the equipment storage rooms.